Thank you so much. And by the way, my wife ran all women's health for America in the Clinton administration. She was Assistant Surgeon General, two-star Admiral,
Yeah.
Counselor. So I appreciate your service, what you do. You're absolutely an ongoing critical issue that we have to work on. And I appreciate this opportunity to discuss the challenges Americans are facing to afford their health care. Yet I cannot overlook the cruel irony that President Trump and my Republican colleagues are blaming rising costs on the very protections and programs that have helped to make healthcare more affordable for so many. Just this summer, Trump and Republicans cut $1 trillion from Medicaid, stripped 15 million people off of their health care to give CEO billionaires tax breaks. And for the past year, Republicans have ignored the ticking healthcare time bomb of expiring ACA premium tax credits. So now, heading into Christmas, instead of picking out presents, millions of families are wondering how will they be able to afford to stay healthy when their premiums double or triple next month. So, Ms. Strauss, in your testimony, you described the ACA as restricting flexibility and driving up costs, but the reality of the flexibility before the ACA was that health insurers regularly excluded pre-existing conditions and capped benefits, and families were drowning in medical debt and bankruptcy. So I'm a little bit dismayed that you and some of my Republican colleagues want to take us back to a time when people with chronic conditions were regularly denied coverage. The only ones likely to benefit from those recommendations are health insurers looking to cut benefits and force families to pick up the tab. And as the ranking member of the Senate Small Business Committee, I appreciate you being here testifying on behalf of millions of small business owners. However, I just want to tell you that there was a recent survey that found 87% of small business owners want the ACA tax credits to be made permanent, 87%. There aren't many things you can find 87% as a number that touches any polling number. And I'll tell you why. 10 million small business owners and their employees who rely on the tax credits to afford health coverage are actually going to lose their health coverage or see a 50 to 75% increase. That's 10 million small business people right after Christmas lose this benefit. And those are Kiwanians. Those are Rotarians. That's Main Street America. I mean, Main Street America is going to be turned into Pain Street America on January 1st of next year, 5 weeks from now, 4 weeks from now. Just absolutely unbelievable. So that's a big, problem that I have just in even talking about small businesses, that they are absolutely going to get crushed across the country. Dr. Fegan, you have spent over 4 decades caring for patients. Some of the Republican proposals we heard today focus on expanding health savings accounts and encouraging people to enroll in junk plans with higher deductibles and fewer benefits. But as you know, millions of Americans can't even afford to cover an unexpected expense for over $400, let alone contribute to an HSA. Would you say that increasing access to HSAs is an effective replacement for families who will lose either their Medicaid coverage or premium tax credits next year?
It is not. We actually refer to the junk policies as something like a hospital gown. Looks pretty good in the front, but everything's hanging out in the back. It creates the illusion of having coverage, but when you actually need it, it's not there and it's not sustainable.
Okay, and what's hanging out in the back? What don't they get? What will they be missing?
It's the out-of-pocket expenses that they have to shoulder. People have the illusion of coverage, but because of the high deductibles and because of the high co-payments, people make decisions about foregoing care or not getting a test. So at the end of the day, they have less care.
Yeah, so we just have to be realistic about what is about to unfold. It's 22 million Americans, who are about to see a loss of their health insurance or a dramatic increase in their costs. And I have one man in Natick, Massachusetts, Jeff, who right now his costs for stage 4 lung cancer drugs is $30,000 a year. Beginning in 4 more weeks, it's going to $300,000. Once the ACA tax credits expire. And there's going to be 22 million other stories that are being told at dining room tables all across the country on Christmas Day. So we've got to solve this problem. We've got a good solution already in place. We just can't allow it to expire. There'll be a healthcare catastrophe which will be unleashed on families across the country. Thank you, Mr. Chairman.
In the interest of an informed discussion, with the problems Dr. Fegan identifies with the health savings account are actually the problems with the status quo, with the $6,000 deductible. If you give somebody a health savings account with, say, $1,000 or $2,000 in it, they actually have first dollar coverage for their deductible and their copay, and their net deductible would be less than status quo. So I think, and it's pre-funded, not funded out of their wages. So I think that's a misconception that's been repeated several times here. It is a misconception. With that, this concludes the hearing. I thank my witnesses for being here. I thank my colleagues. It was very well attended. Questions for the records will be due. Hold it, hold it, hold it. The tension is building. At close of business, what's today? Oh, it's Friday. What's that?
17.
Any senator wishing to ask additional questions for the records will be due 5 p.m. Wednesday, December 17th. Thank you again for being here. We are adjourned.